Here we have the transesophageal heartwork simulator probe in my left hand. We'll go over some of the cardinal movements of the probe. However, prior to that, let's take a look at the probe itself. You'll notice that the flat part of the probe is going to be where the transducer crystals are. So this is the part that will be inserted into the patient's mouth, with this facing the tongue and the floor of the mouth so that it can be deployed into the esophagus and look straight at the heart. Here's our controller. You can see that there is a big wheel and a small wheel. On the lateral side of the controller, you can see two buttons. These are going to be our multi-plane buttons, which we'll go over here in a moment. First, let's start out by looking at what the big wheel does. So this wheel can be rotated in a clockwise or counterclockwise fashion. If we rotate the wheel counterclockwise, you're going to get retroflexion. Take a closer look at that. Counterclockwise, retroflexion. And if you rotate the wheel clockwise, you're going to get anteflexion. Let's take a closer look at that. Moving on to the small wheel, this can also be rotated clockwise and counterclockwise. Here's our counterclockwise rotation. You're going to get flexion to the left. And with clockwise, you're going to get flexion to the right. Lastly, take a look at the buttons on the side. These are omniplane buttons, and they correspond with the angle on the ultrasound machine. This is one of the most important movements for transesophageal echocardiography. So let's take a look at how this works. We have a top button and a bottom button. On this simulator, it's red and black. If you touch the black button, it's going to increase your angle. If you touch the red button, it is going to decrease your angle.